When prime is complete, stop the blood pump and clamp the blue venous clamp near the venous patient connector. Remove the venous recirculation connector and open the cap of the arterial recirculation connector. Now connect the venous patient connector to the open arterial recirculation connector. Purge all air from the venous chamber by opening the pigtail line clamp and loosening the end cap slightly. When the venous chamber is completely full, clamp the pigtail line and retighten the end cap. Lightly tap on the pods and dialyzer to dislodge any remaining air bubbles. Now perform the machine test. After the test has been completed, insert the venous blood line into the machine's line clamp following manufacturer's recommendations. Attach the dialysate hoses to the dialyzer. Make sure that all air is purged from the dialysate compartment by removing the dialyzer from the dialyzer holder and tip it until the red dialysate port is slightly higher than the blue port, keeping the ports facing up. You will see the air being cleared from the dialysate compartment. This should take less than 30 seconds. Return the dialyzer to its holder. Verify the arterial and venous pod monitor lines are connected to their respective machine pressure ports with the clamps open. Restart the blood pump and recirculate the system according to your facility's standard procedure. At the termination of recirculation, stop the blood pump and close the priming line clamp. Make sure that all connections are secure. You can now initiate treatment according to your facility's procedure. Be sure to always keep the patient connections visible. Observe the blood flow through the pods and ensure the diaphragms are functioning properly. The arterial pod diaphragm should be visibly pulsing and full of blood without a clear window. The venous pod should be visibly pulsing and full of blood, and the diaphragm will not be touching the dome. Also, check and make sure the arterial and venous pressures are appropriate. If either diaphragm is not functioning properly, it can be quickly corrected. For the arterial pod, stop the blood pump. Now disconnect the arterial monitor line from the machine and allow the diaphragm to return to the correct position. Once the diaphragm is in the correct position, reattach the monitor line and restart the pump. It may be necessary to open the priming line briefly to reseat the diaphragm. For the venous pod, stop the blood pump and reset the machine alarms if necessary. Clamp the venous pod monitor line and disconnect it from the machine. Attach a 3 cc syringe to the lure of the monitor line. Open the clamp and inject only 3 cc's of air. Make sure the diaphragm returns to the proper position against the blood path dome. Reclamp the monitor line and reattach it to the machine pressure port and restart the pump. Unclamp the monitor line clamp and verify that you have an appropriate venous pressure. Machine alarms that might indicate improper diaphragm placement and/or clamped disconnected monitor lines are TMP alarms. Arterial and venous pressure display reads 0. Arterial and venous pressure alarms. If any of these occur, check the arterial and venous pods to make sure the diaphragms are functioning properly. Never use the arterial or venous level adjust pads or toggle switches. There are no levels to adjust as the system is airless and the pods and venous chamber remain full throughout the treatment. The venous chamber fluid level should be raised to the top prior to starting the treatment and whenever necessary during treatment by gently loosening the cap on the pigtail line at a low blood pump rate. If you use the priming line lock site to pull saline or to give medications, do not return the protective cover after use. This signals that the lock site has been used. If you want to reuse a lock site, simply clean it by laying an alcohol wipe over the lock site female lure opening and use the long probe on the protective cap to push the alcohol wipe firmly down into the opening. Push and rotate to completely swab all surfaces. The mainline tubing lock site can be used for blood sampling during treatment and for post-treatment sampling. If you disconnect the priming line from the mainline tubing, connect it to the priming line lock site to protect it from contamination. When sampling is completed, Clean the main line lock site as previously described and reattach the priming line. At completion of the dialysis treatment, return blood to the patient according to your facility's procedure. Blood may be returned either by prograde or retrograde rinseback. Prior to prograde rinseback, you may fill a syringe from the priming line lock site so you can return the blood in the arterial access device. For prograde rinseback, stop the blood pump, clamp the arterial main line tubing near the patient connector, and disconnect the arterial patient connector from the arterial access device. You can now return the patient's blood in the arterial access device with the saline-filled syringe. At this point, attach the arterial patient connector to the priming line lock site. Now open all clamps. Start the blood pump and rinse the entire system according to your facility's protocol. Dispose of the set according to your unit policy in an approved biohazard container. The sincere goal of Medisystem's introduction of the Streamline Airless System set is first and foremost to improve therapy outcomes for your patient and provide benefits for your facility.
The only difference in other bloodlines is the type of clamps or where you can access for injection ports and those sorts of things. This is the only bloodline that's different, and it's a benefit to us and a benefit to the patient.
Medisystems has always been a leader in innovation and has always brought high quality and high performance products to the hemodialysis market. Medisystems customer service is always available if you need more information on the Streamline Airless System set or any other Medisystems product. Please contact us at 800-369-MEDI or at www.medisystems.com. Special thanks to the patients and staff at Tri-State Memorial Hospital Dialysis Unit in Clarkston, Washington. This video is intended as a practical guide to the use of Medisystem's Streamline Airless System set with the lock site needleless access sites and is not a replacement for the standard operating procedures at your facility. It does not take the place of reading the instructions for use found in every Streamline carton or machine operator manual.
As far as I'm concerned, they're a get-her-done new line, and I really enjoy them.